Your spine protects your nervous system, governs and controls everything, all the functions. So the skull protects the brain and the spine protects the spinal cord. So if it's in proper alignment, the proper nerve transmission can go to whatever cell it's going to at 100% quality and quantity of a nerve impulse, and that expresses optimal health. And if we impede that flow of nerve supply to the cell, then we have a compromised health. And that's what chiropractors, we just make sure that the nervous system has no interference and allow the body to run, because it's pretty smart and knows what to do. How does that work? Think of a hose, goes to a garden. The garden is flourishing, has plenty of water. Kink in the hose reduces the amount of water to the garden, and it doesn't flourish. So as a chiropractor, I would unkink the hose. The problem why people get misalignments could be a number of reasons: past automobile accidents, slips and falls, poor posture, poor diet, lack of exercise, poor attitude, all can impact the position of the spine. For instance, if a patient comes in and has sinus issues, doesn't have any neck issues, but knowing that in the neck, nerves run to the sinuses, and depending upon the level of where there could be some nerve interference, I would give that a chiropractic adjustment, and many a times sinuses will clear, digestion normalizes, a number of things can happen just from a specific adjustment. I think a good example of the safety of chiropractic, it merits, or it's the amount of malpractice that we pay. It's pennies. It's pennies that we pay because of the incidents that occur. And it's just not us saying that problems don't exist most times with chiropractic. It's a whole other entity that is an independent survey that says we don't have a lot of problems, so they don't give us these large amount of premiums that we have to pay like our medical colleagues. A person should trust a chiropractor to adjust them because of the specificity of their training. It's primarily spine and joints, but I feel that if a chiropractor is working on the spine or the joints every day, they have the experience to make the right decision. It's like tires that are properly aligned, they don't wear. And you don't have the ongoing pains and the accelerated arthritis that a lot of people have. So if the spine is in that proper alignment, you're not going to have wear and tear and maximum movement, which movement is health. If a patient comes in with a specific problem, I have to find it. So I find it with my hands. Chiro means hands, practice means practice, so we practice with our hands and we can feel the specific alignments up and down the spine or in a joint to determine if it's in the right position. And then I give what's called a spinal adjustment. A spinal adjustment is when a chiropractor uses his hands to position the spine in the proper alignment.